Thank you so much, Maria. So we're really excited to be talking to you guys today about our telehealth project that we've been working on specific to Colorado. It's the first one in Colorado, so we hope that this is a useful presentation for you all. And please feel free to ask questions as we go along. I know sometimes it's hard to be as interactive in a webinar format, so don't be afraid to ask your questions as we go. So I'm going to start off just by introducing myself. My name is Bethany Copper. I am one of the Colorado SANE Safe Project trainers and telehealth instructors. I've been a nurse for just over 9 years. My background is in emergency medicine. I've been a forensic nurse for 8 years. I began my practice in Pennsylvania, where I'm from, in an on-call setting as an on-call SANE. I've worked in both urban and rural environments. And when I moved to Colorado in 2017, I was really fortunate to stumble into a fully in-house comprehensive forensic nurse examiner program that we'll tell you a little bit more about in a bit. So I've been with this team at Memorial since 2017, and I've been a trainer with the Colorado SANE Safe Project for about 1.5 years.
And hi everyone, just wanted to welcome everybody to the webinar. My name is Amanda Van Nest, and I am a forensic nurse examiner at UC Health Memorial Hospital in Colorado Springs, and I am a telehealth instructor for the Sexual Assault Response Project. I have been working as a forensic nurse examiner for almost 4 years now, and have transitioned into the telehealth instructor role at the beginning of last year. I have been a nurse for 9 years, and prior to working in the field of forensics, I worked as a nurse in the recovery room for 5 years.
Okay, so we wanted to start off by talking to you guys a little bit about the grants that we are working on to give you a bit of background on our beginnings in this project. So I'm going to start by talking about the Colorado SANE Safe Project. So this is a grant-funded program through the Division of Criminal Justice. This started in 2013. We currently have 3 full-time nurse educators, or trainers as we call them, including myself. And our mission is to provide statewide didactic and clinical education for anyone who wants to provide care for patients who've experienced sexual assault. So we have the 64-hour online sexual assault forensic examiner training. And then we also have a clinical component that partners with that. It's our clinical skills lab where nurses and providers can come get hands-on training. We provide continuing education as well and technical assistance. So we have 24/7 availability for providers to call and ask questions if they are dealing with something, whether it be a patient, an evidence question, anything like that. We are based out of UC Health Memorial Hospital, so if you happen to hear our overhead announcements, that's why. And I wanted to spend a little bit of time talking about SANEs and SAFEs. So it sounds like most of you are advocates, so you may already be familiar with these terms, but I just wanted to let you know why we use the SANE SAFE acronym. So SANE is a sexual assault nurse examiner. Those are registered nurses. SAFE is a sexual assault forensic examiner. So this is any provider other than a nurse. So this can be a physician assistant, nurse practitioner, or physician who also see patients. So in the Colorado SANE Safe Project, or COSSP as we sometimes call ourselves, we essentially take the place of a state SANE coordinator. There are certain states who have this position. I know Maine is one of them. And this kind of allows everyone to get their information from a single source and get their training from a single location. So we're really lucky to have this in Colorado, and because we're grant funded, everything that we offer is free. So this is an enormous benefit to locations. So we're able to provide everyone with the same starting place and foundation for sexual assault care through the Colorado SANE Safe Project.
In addition to the COSSP grant, we have also been awarded in October the Sexual Assault Response Project Grant, or SARP. You might hear me refer to it as that as well. And so in order to understand this a little bit better, I put together a diagram just to kind of look at the layout and the flow of this, because it gets kind of confusing when you start talking about it. So the SARP project is a grant-funded program with grants being administered through the Office on Violence Against Women, which then funnels down through the Department of Criminal Justice and then goes into two different subrecipients, which is UC Health and COSSP. And then you'll see it branching out again into the SANE SAFE component. And then on the other side of your screen would be the SART component. So the SARP's project overall goal is to increase support for survivors of sexual assault in Colorado. And so again, you know, in order to do this, the two main areas of focus are through the medical support component and then through the community response and the community support component. So just to touch and to go in a little bit further into the SART support component, if we break this down into this, we can look at specific ways that this grant can offer support in this area. So its two main goals in this is to increase access to training and technical assistance opportunities for existing SARTs and agencies and communities that want to establish SARTs, and to increase access to information and resources regarding a coordinated victim-centered response that utilizes best practice. And then next we will look at the SARP grant again, but in regards to specifically for the SANE SAFE support component of this. So you basically just with this, we want to increase access to trained SANEs and SAFEs via telehealth here in the state of Colorado, and to increase access to training and technical assistance opportunities for existing programs and programs and communities that want to establish SANE and SAFE programs here in the state of Colorado.
So a question just came in, or rather a clarification. Asks, just to be clear, that you must be a nurse, physician's assistant, nurse practitioner, or a doctor. They mentioned that they have a midwife that is not any of those, but would like to be a SAFE examiner in their rural area of Southwest Colorado.
As long as it is a certified nurse midwife who usually has nurse training first and then goes on to get additional education to be a midwife, they are able to provide care as a SANE or SAFE.
Perfect, thank you.
Of course. Okay. So to kind of continue on, you know, in regards to the SANE support component, we wanted to talk a little bit about our program and how this, you know, helps us, makes us qualified to be able to offer this support to the state. So we are based out of UC Health, Memorial Central, and Memorial North hospitals here in Colorado Springs. We are a 24/7 fully in-house program. The forensic nurse examiner program here, we see all patients who have been exposed to violence. So this includes child abuse, elder abuse, intimate partner violence, physical assaults, strangulation patients, human trafficking, and sexual assaults. And just to give you guys, you know, a better idea as to the volume of patients, in 2018, our team as a whole saw approximately 2,200 patients. So, you know, in addition to this, Bethany has already talked a little bit about the SANE SAFE project and the educational support that is being offered through that. But coupled with the amount of patients that we see in the volume that we are exposed to, kind of really puts us here at Memorial and in this program in a unique position to be able to offer support in other ways through telehealth and through the grants that we have received. And we'll talk about that a little bit more.
Okay, so I wanted to spend a little bit of time just talking about telehealth itself, just for clarity purposes. So what is telehealth? Telehealth is the use of technology for long distance healthcare, patient education, and provider education. So you'll often hear telemedicine and telehealth used kind of interchangeably, but to be clear, telemedicine is actually direct patient care. So this would be the provider on one end of the telecommunication software and the patient directly on the other end. So if you've done a virtual visit during the COVID pandemic with your primary care provider, you've had telemedicine. On the other hand, telehealth is a little more broad, and this involves direct patient care as well as continuing education and training and support for providers. So that's why telehealth is specific to the project that we're talking about. Additionally, there are lots of different methods that can be used for telehealth. The first would be synchronous. So this is real-time patient care. This would be the patient and provider speaking to each other in real time. Then there's something called asynchronous. So this would be messaging back and forth between the patient and provider, image sharing, results sharing. So this would be any type of electronic health record that you may have access to. I know UC Health has something called My Health Connection, where you can send messages back and forth to your providers and get your lab results and different things like that through that online portal. And then finally, there's something called remote patient monitoring. So this is done through cardiac monitoring or something known as telemetry, as well as ICUs. So some rural locations that don't have critical care nurses are able to have critical care nurses monitoring their patients remotely. So that nurse would have access to the patient vital signs, their lab results, and things like that, and then can communicate that back to nurses at the bedside and direct them in the patient care. So telehealth has actually been used for quite a while. The most familiar one, I feel, for most providers is telestroke care. So this started in 1999, and it's actually become the most extensive means for increasing access to and providing stroke care to patients. So as you see in the photo on the top right of the slide here, this would involve a neurosurgeon or stroke specialist speaking directly with the patient and then directing the bedside provider, who's usually an emergency room provider, in how to stabilize that patient and provide appropriate stroke care until that patient could be either transferred to a comprehensive stroke center or stabilized. Another use for telehealth is in mental health and behavioral health services. So this is something that we actually use at our facility. We have both the Memorial Central and Memorial North campuses. Our behavioral health evaluators are based out of our Memorial Central campus. So if there is a patient that needs an evaluation at the North campus, they connect with that patient via telehealth and do their evaluation that way. And then, as we've all seen during COVID, there was a rapid expansion to adapt to this changing healthcare environment, including decreasing exposure of providers and decreasing exposure of patients. So this led to the rapid implementation of virtual visits in a variety of settings. So for non-emergent conditions that you needed to see your primary care doctor for, a lot of these were done virtually. Any questions, routine health screenings, or behavioral health issues such as counseling, all of these things were very quickly moved to a telehealth environment. So additionally, we wanted to talk about some benefits of telehealth. The primary benefit, especially for our patients, is to receive care locally. So we'll talk a little bit more in a minute about the unique environments in Colorado that make that especially necessary. But for patients who've experienced sexual assault, allowing them to receive care in their local area allows patients and their families to stay closer to their social support that's available to them in their home community. It also decreases the need for transfer to another facility and decreases costs as a result of that. So sometimes if a patient presents to an emergency room that doesn't have a SANE program, they are then transferred, sometimes even via ambulance, to the next closest facility. That could involve that patient receiving 2 emergency room visit charges as well as the transportation cost. And this can be an enormous barrier to patients receiving care following a sexual assault. So telehealth is regulated by a variety of sources, the first being the federal government. So telehealth has to comply with HIPAA, which is the Health Insurance Portability and Accountability Act. Next, it's regulated by the state individually. This regulates provider licensing according to who can provide telehealth care. It also regulates patient consents, whether they have to be written consent or verbal consent, and also affects reimbursement for fully insured private plans that may be offered through the state. Additionally, insurance providers are free to decide which telehealth services their plans will cover. So specifically, 2 of the most important plans are Medicare and Medicaid. This covers a large portion of our sexual assault patients. So Medicare is regulated by the federal government, and Medicaid is regulated both by the federal and state governments.
So we have talked about our different grants and what telehealth looks like generally, but why is there a need? What does sexual assault look like here in Colorado? Why does this need to be improved upon? So according to the National Intimate Partner and Sexual Violence Survey, in Colorado, 1 in 3 women, 1 in 3 men, and 1 in 2 transgender individuals will experience an attempted or completed sexual assault in their lifetime. So in regards to availability of medical care, these victims, in the SARP grant proposal, it identified that approximately 21% of hospitals in the state of Colorado have a SANE safe program. Whoa, if I could talk, have a SANE safe program, with the majority of these being along the Front Range urban corridor. So we will review in later slides, the actual layout of the programs in the state and what it looks like, in a map. But as you get out of the Front Range and the urban corridor locations, the availability for these exams and locations become much more sparse. So it can be really difficult and sometimes impossible in some circumstances for a sexual assault victim to travel to a city that provides SANE safe services due to lack of transportation, the long distances that they would have to travel. Here in Colorado, road conditions due to weather, and especially, in the mountains and in the winter. And so because of this, Colorado really needs to, and when looking at all of this and how we can improve the care, needs to be able to comprehensively address the needs of communities and the SANE safe programs across the state, with really an emphasis on the rural communities.
So now we're going to talk about what is the benefit of telehealth for SANE programs specifically. So in addition to all of the issues specific to Colorado that Amanda was talking about, there are a couple other things that telehealth addresses. So continuous learning is necessary in all forms of medicine and nursing. And telehealth is able to address some of the common issues that are experienced by rural or low volume SANE programs. So the first is low patient volume. Some on-call SANE programs may see only a few patients each month. This makes it really difficult for SANEs to maintain their competency and confidence. If they're only taking maybe 1 call shift a month, and perhaps that program only sees 3 to 5 patients a month, there's a high probability that nurses could go several months in between each exam. Additionally, divided attention and split focus. Most on-call SANE programs have nurses or providers that have other primary jobs, where seeing victims of sexual assault is only part of what they do every day in treating patients. Additionally, difficulty obtaining continuing education. For a lot of the reasons that Amanda was just talking about, Colorado's geography makes it hard for people in rural and low volume areas to get to areas where continuing education would be occurring. Additionally, difficulty obtaining quality peer review. Peer review is the gold standard of nursing quality improvement. In fact, it's one of the ANCC's magnet program standards. It serves not only as a means of individual performance improvement, but also as a means of identifying common areas with room for improvement within a program. True peer review involves reviewers being at the same level. So for example, all clinical SANEs, not just managers and coordinators. So if you're operating in an on-call environment, it might be difficult to get back to a place where you can provide peer review in a timely fashion. And finally, high turnover and burnout. Because it's so difficult to maintain competency and confidence in some of these on-call programs, there can be a lot of hiring and leaving of nurses. So this can make it even harder to maintain that competency that comes with several years of experience doing this work. So telehealth provides the support and education necessary to address these issues.
So this really leads us into, what does telehealth look like for SANEs overall? Who has used it? What do their programs look like? Because this really helped us to get an idea as to where we wanted to go with this. So we'll start off with the National TeleNursing Center. So this was founded in 2012. They started off as a pilot program and did a study from 2015 to 2018, where they looked just at 129 patients who received sexual assault care, with the SANEs having, my goodness, lost my place, where they received sexual assault care from clinicians who were being provided with that additional support from the offsite SANE. So the assistance that was provided to them, included guiding clinicians through history taking and documentation, forensic examination and evidence techniques, and identifying and documenting injuries, and really just helping to guide their clinical practice. So when they, looked at the study of 129 patients, they found that using this live telehealth support for sexual assault medical forensic exams really is a promising practice. And the feedback that they received from the site clinicians was overall very positive. And it actually had been reported to improve these clinicians' confidence, in providing an effective exam.
So the next one that we looked at was the Penn State Safety Center. So this was founded by Dr. Sheridan Miyamoto. She initially began with research in California that looked at the use of telemedicine for pediatric sexual assault exams, and published a 2014 article titled "The Impact of Telemedicine on the Quality of Forensic Sexual Abuse Examinations in Rural Communities." This research found that the quality of exams were improved with telehealth. Additionally, the exams were found to be more complete and included more accurate diagnoses. So following this research, Dr. Miyamoto began the Penn State Sexual Assault Forensic Examination Telehealth Center, also known as the Safety Center. So this program was grant funded through the Department of Justice Office for Victims of Crime. They are currently based out of State College in Pennsylvania, where Penn State University is located, and they work with 8 rural sites throughout Pennsylvania. They offer 24/7 expert telesane coverage to help walk the local examiner through the examination process. So now we're going to talk about, having all of these things in mind, how did we come to approach the project that we are working on here in Colorado? So we started by using our specific grant goals and objectives as our outline. So we researched what programs exist and how they're modeled, what equipment they're currently using, and the available Colposcopes. We'll talk a little bit more about that when we speak about equipment. But we started the research project in 2019, January of 2019, and started looking into this and deciding how we wanted our program to look based on this information. So a good place for us to start was looking at our stakeholders. So our key stakeholders included UC Health, as our grants both partner with UC Health. So we submitted a virtual health request through our telehealth program within our telehealth department, I should say, excuse me, in UC Health. And then our next important stakeholders were the SANE programs in Colorado. So we sent out a survey to all of the coordinators for SANE safe programs within our state, because we really wanted to build a partnership that gave the sites the support that they actually need. So we started with looking at what is it that they need. We also formed a mission and objectives for our project. So our mission is to collaborate with communities in Colorado to empower the bedside SANE in real time to provide expert care for patients who have experienced sexual assault. Our objectives include empowering the on-site SANE. We want to increase confidence in the on-site SANE's ability to complete examinations and know where to go for help or more information when they need it. We want to be their backup in real time. Next was to improve the quality of the medical forensic exam. 2 sets of eyes are always better than 1, and knowing that you have someone to bounce ideas and questions off of when it's happening adds a lot to the quality of the exam that we're able to provide. Lastly, we wanted to improve the retention of local SANEs. SANEs that are more confident, more competent, and feel more supported will stay on and continue to help build high-quality SANE programs throughout our state. This is especially true in rural or otherwise underserved areas. So based on our research, we decided how we wanted our examination flow to be. So 2 important definitions for our project were the on-site SANE and the consulting SANE. The on-site SANE is a trained SANE at our partnering facility who's performing the medical forensic exam. So this is the nurse who is at the bedside with the patient. The consulting SANE is the expert SANE who is there to be a virtual preceptor with the on-site SANE during the medical forensic exam. So below you can see kind of our flow of how this process is going to work. So the first step is the patient arriving to the site, reporting a sexual assault. There, the nurse will present telehealth as an option and then contact the consulting SANE to let them know that a patient is there for an exam. Next, the patient will be registered and consented for telehealth and will begin video conferencing. This allows the patient to see the consulting SANE and the consulting SANE to see the patient. The consulting SANE is going to remain virtually present, meaning with our video conferencing, with the on-site SANE during the entire duration of the care provided. This includes providing the exam itself, assisting the on-site SANE with documentation and with evidence packaging. Then following this, the consulting SANE and on-site SANE will set up a time to go over the case later so they can talk about what went well, what needs improved, and the on-site SANE comfort level or specific needs in the future for examination support. So with this in mind, we needed to select some sites to work with. So on the right-hand side of your screen, you can see a map of Colorado. The red cross in Colorado Springs is Memorial Central. That is our main hub for the Colorado SANE Safe project. And then all of the other dots on the map represent existing SANE Safe programs at the time that we were looking at starting this project. So a couple of key components that we wanted to look at when selecting our sites. The first was the ability for that site to have trained SANEs on hand. So we looked at each site and how many SANEs each one had. Additionally, we looked at their SANE availability coverage. So whether this was 24/7, just in off hours, weekdays, weekends, etc. Next, we looked at the community need. So we wanted to specifically select rural sites or sites that were far from other locations or training locations. We also looked at community partner engagement. This would be their partnership with advocacy, local law enforcement, other things like that. And then lastly, program buy-in. So do the sites feel that telehealth will be beneficial to their program? Will the local SANEs see this as a benefit rather than a hindrance? And will they actually use it? So as part of our grant, there is a requirement that each site must use telehealth for at least 50% of their examinations. So we wanted to select sites that would use at least a minimum of 50% of telehealth support for their examinations. Other considerations were the volume of patients seen by the program, just so that we could balance out the number of calls we would be expecting from each site. So our first pilot site is going to be Mercy Regional Medical Center in Durango. We selected this site for a number of reasons. They had a really robust team who are highly engaged in the Colorado SANE Safe project already. They were extremely interested in additional support and training. And additionally, they support a tribal population in their location. So this is really an area that we wanted to help support. Our second site is going to be Montrose Memorial Hospital in Montrose, Colorado. They have a growing team who's also been highly engaged with the Colorado SANE Safe project already. And they also were interested in additional support and training that could be offered specifically as a result of the telehealth partnership.
In regards to, let me get a little bit closer to the computer. In regards to selecting sites for the SARP project, a lot of what we did was to start with the research that Bethany had already done. We again started with looking at the needs of the state by reviewing the survey results from the SANE coordinators in Colorado, and also working with COSSP to review SARP needs throughout the state. So were they aware of any SANE programs in their community that they felt like would benefit from the additional support of telehealth? And then we actually went on to call all of the hospitals in the state just to make sure that all of the SANE and SAFE programs were being accounted for when we went about researching and making our decisions. So as a result of all of this, we were able to again map the areas that were already providing services and go from there. We really looked at everything from a geographical standpoint for state coverage, and then started reaching out to individual locations just to get more detailed information on their SANE programs. Again, their hours, are they in-house, are they on call, how many SANE nurses, how many trained clinicians are there being able to provide exams, what number of patients, what is the volume of patients that these sites are seeing every month, and just looking at their overall infrastructure and support. So in regards to the first site for the SARP project, Mountain West SANE Alliance will be the first pilot site for this grant. So in regards to this, their program is housed within Riverbridge Regional Center, which is actually a child advocacy center. So they kind of took them under their wing to be able to provide care to sexual assault patients, sexual assault victims in the adult adolescent population. So they are able to have their own secure area where they can see both the adolescent and adult patients within Riverbridge. And they serve the populations of Garfield, Pitkin, and Rio Blanco counties. So it's quite a big area that they cover. And their program offers 24/7 coverage, and they have really engaged and really engaged SANEs who would appreciate and are interested in the additional support that the precepting and the telehealth can provide. And then additional sites are to be determined with this as well. But the SARP grant is actively working with, with additional sites and speaking and building those relationships and partnerships to figure out where best to go next.
So for this project, we had equipment that we needed to select to make this successful. So the necessary equipment for telehealth includes video conferencing equipment and a Colposcope. So for the video conferencing equipment, this allows us to see the patient and the patient to see us. We were lucky that UC Health already has an approved HIPAA compliant video conferencing software. This is called Video, so it's VIDYO. We were able to piggyback off of the existing contract with UC Health to be able to use this for our project as well. In looking at a Colposcope, a lot of people on this webinar may not be familiar with what this piece of equipment is. So a Colposcope is actually a microscope attached to a camera, and it's used for the genital exam. This piece of equipment does not touch the patient in any way. It just allows us to have better visualization of the structures than we would be able to see with just our eyes. So it's extremely helpful for a thorough assessment and differential diagnosis of normal variants versus a disease process or injury. So a lot of programs, especially in rural or low volume areas, don't have the funding to purchase a Colposcope, and maybe even if they have one, they don't have the familiarity and comfort with using it. So specifically, this telehealth partnership can really add to the quality of the examinations by providing a Colposcope and the appropriate training and live support when using it. So a couple of things to consider when selecting a Colposcope were options of a manular or binocular Colposcope. This is the image on the far right that you see here. It has kind of the binoculars that look like a typical microscope, excuse me, with the camera attached versus a video Colposcope, which is on the middle photo that you can see here. So we had to look at usability, and the video Colposcopes are a lot easier to use than the manual ones. They require a little more tweaking and adjustments during the exam, so that was something that we took into account. Additionally, photo storage. So some Colposcopes use a cloud-based storage for photos versus a secure drive. So these are things that we also took into account. So we selected the Lutech LT300 HD Colposcope that you see here on the screen. This is a video Colposcope that allows for a little bit easier usability for the on-site SANE. This has a 3-year warranty, free shipping, and a free 30-day trial. We did do the free trial and had an excellent experience with the customer service during this. You also have the ability to purchase this Colposcope directly from the manufacturer, and they do have special pricing for SANE programs. So this HD model is about $6,900, but they do have discounts, like I mentioned, for SANE programs. Because it is a video Colposcope, it is easily connected to telehealth access. It does have physical buttons on the back of it, and it comes with a little remote that you can use to adjust it, as well as a foot pedal to allow for easy photography during the exam. And it comes with easy to use video software to capture photos. It connects to a laptop, as you see here on the screen, so that you can visualize the photos and the examination in a larger format than on the back of the screen. And it has no cloud storage for photos. This was something that we found really important for our project because of the delicate nature of these examinations. We felt more comfortable with the ability to direct download photos into a secure drive for increased privacy and security versus an online cloud storage platform.
So when it came, when coming into this, there was an idea and thought as to what we were envisioning, but, just kind of had to obviously, as the slide says, build the framework. So, how would this look? So logistics wise, throughout this project, we have been continuing to work with multiple departments in order to implement this. So our virtual health department and IT, has been working with us to figure out how this will look and how this can look. And security has also been involved to make sure that what we are wanting to do is done in a safe and secure way for the patients. Legal has also been involved with us by helping to write up the contracts for our sites. And, in addition to these things, Bethany has also been pretty instrumental in developing our department guidelines and our consent form that will be used when consenting the patients to telehealth. Something else that I wanted to bring up here in regards to building the framework was the qualifications for the SANEs on our side of things. So the precepting SANE, what their qualifications would look like. So, in talking with this, we wanted somebody, an experienced SANE who had the experience and the expertise to be able to support those other sites. We are looking at them having at least 3 years of SANE experience and to hold both their SANE A and SANE P certifications. So this is, just like a certification in any other field, and this basically just helps to distinguish them as experts in this area of SANE nursing. In regards to future projects, looking into the future with what we are planning to do, we are looking to have 10 sites total. 4 sites within the COSSP grant, which would be Bethany's. So Bethany's looking at being able to support 4 total sites at the end of this project. And in regards to the SARP grant, we are looking to be able to support 6 sites. So myself would be able to support 4 sites, and then we would add an additional instructor to support 2 sites. So, I think that ultimately being able to build a successful and sustainable program that can continue to support SANEs throughout the state is what we are wanting for the future. And so in whatever way we can do that. So continuing to offer that SANE support at existing sites, helping to implement that support at future sites, helping to develop new SANE programs in areas that are interested in wanting to have these SANE programs, and just that continued educational support is really, really what we're hoping for the future of this. And looking back at what we have done so far, I think overall it has really been a huge success as to what we have been able to accomplish. But there has also been many challenges along the way as well, as with anything. But I think one of the biggest challenges for me, and probably for Bethany too, was just being able to get everyone on the same page and helping everyone to understand first and foremost what a SANE nurse does. And then, once we were able to get people on board and understanding that, then being able to apply it to a telehealth environment. Especially since this has not been done a lot before, and this is something that has never been done in Colorado. So the process has been a long one, just with all of the different moving parts and what has to be done. One thing has to be done in order to do another thing, and but those things can be anticipated in some regards with anything. But the one challenge that we couldn't account for, and I don't think anyone could have accounted for, was a pandemic. But this definitely affected, in the speed of the process and the time that things were taking, because essentially our projects had to be put on hold in order to implement the telehealth support and, a primary care, physician role and that type of stuff to be able to offer the care for those patients, which is, lost my train of thought again, but just in regards to that. But with that being said, and to put more of a positive spin on the pandemic, I think that really opened up our eyes to other ways that we could support our sites. So we actually started off being able to and offering virtual trainings through a Microsoft Teams platform with different teams throughout the state, based on the team's request and their individual wants and needs. And I think another success, included the positive support that we received, not only from our manager, but our executive team as well. And really without the support, this project may have looked very different. And not only receiving support, but being able to provide the support and resources to our sites, I feel like has been probably the greatest success of the project thus far.
So we just wanted to kind of bring you back to the overall goals for this project, which are to improve the confidence and therefore retention of SANEs throughout the state. We want to be able to help SANEs provide high quality medical forensic examinations for patients who've experienced sexual assault. And ultimately, we want to help empower communities that patients can receive expert care within their own community without having to travel long distances to obtain care following a sexual assault. So we really appreciate all of your time and attention today. We hope this was a valuable session for you. We'd love to hear if you have any questions. Our contact information is on this slide if you think of something later on. We are always available via email, or our office lines are here as well. So thank you so much. And if there are any questions, we'll be happy to address those now.
Great, thank you both so much. It looks like we don't have any questions that have come in so far. So is there anything that you'd like to leave folks with while they're typing their questions or thinking of their questions, but anything that you'd like to leave folks with at ending this webinar?
Absolutely, thank you. So we would love to hear from communities that would be interested in these types of partnerships. Even if you don't have a SANE program currently, one of our goals is to help build these types of programs so that your community is able to offer this type of care to patients who've experienced sexual assault. So please feel free to reach out to us and allow us to help you get that off the ground. Sometimes it can feel really overwhelming starting a project from the ground up, as we can tell you for certain. We've learned a lot through this telehealth project and feel that we have valuable insight to offer you to help get something started in your community. So please, by all means, feel free to reach out to us. If you already have an existing team that could just use a little extra support, we're here for that as well. Ultimately, we do not want to take control of your region from your community. We want to just be here as added support to increase your community's ability to offer care to patients who've experienced sexual assault.
Great, wonderful. And I did put in the chat box for folks a link to your program website to be able to go and reach out. I will also include both of your emails in the follow-up email that's going to be coming up right after the webinar. So we have a couple of questions come in. The first one is, hold on, let me expand it. It's a long one. My team is about to take on doing inmate exams at Buena Vista Correctional Complex, and some of my SANEs have not seen male patients before. Is that something that this program could be helpful for, to provide support and assistance to them during exams?
Yes, absolutely. We also offer care to male patients as well, and that's something that we see in our current program, and so that would absolutely be a partnership that could work for this. Absolutely.
Wonderful. And if you would like, Shelly, I can give them your contact information, or vice versa, to get you all connected. So just let me know in the questions chat box if that would be helpful. The second question that came up was, do you see this program aiding the many DoD communities UC Health currently supports?
Absolutely. I think this is really an area where telehealth could be extremely valuable. Some of the programs that we spoke about earlier, Amanda talked about the National TeleNursing Center. Some of their sites specifically were military installations. And this is definitely something where I see telehealth being extremely valuable for all the reasons that we spoke about. You know, the amount of turnover that happens at military installations and just that difficulty with keeping up with the local regulations and resources. Telehealth can really bridge that gap and help build and strengthen the ability of those units to offer care to their servicemen and women.
Wonderful. Thank you again, Bethany and Amanda. It looks like there aren't any other questions, but if a question does come up, like they mentioned, feel free to reach out to them in their emails. I will be sending their emails once again in the follow-up email. So just to close this out, I do want to again say thank you very much to both of you for spending this time with us this afternoon and for all the prep time that you did for it. And thank you all for being with us. Please do look out for that follow-up email containing the copy of the PowerPoint slides and the link to that SurveyMonkey. We generally have webinars each month. We're still working on webinars for the second half of our year. That survey that you will be taking will be really helpful for us and is always helpful for us as we look to you all for ideas and needs of what you all would like to see for webinars and training. So please do fill out that survey. That's really important to us. And once again, thank you for attending the webinar. And thank you again, Bethany and Amanda.
Thank you so much.
Thank you.
Thanks. Have a great afternoon, everyone.